This is Health Tracks, and I'm Peter Graber. The UNC Department of Family Medicine formally unveiled an exciting new addition to its residency training program last week, a new underserved track that's based at the Prospect Hill Community Health Center. The launch capped off a multi-year planning effort by UNC and Piedmont Health Services, and represents a major advancement by the school in helping to train future family physicians who are geared to practice in our state's most underserved communities. Here's a brief recap of the event, as well as some perspectives on some of the key leaders that made it happen. UNC's new underserved track at Prospect Hill is the first of its kind in North Carolina. Prospect Hill was the first in the state in 1970, and now becomes the first teaching health center some 42 years later. UNC worked closely with Piedmont Health Services to create the track that'll train 2 family physicians each year. As UNC Family Medicine Department Chair Dr. Warren Newton explains, it's a program that's based on need, both for the state's underserved communities and for community health centers.
We started out, and here I'm speaking about the Department of Family Medicine, being very aware of a critical need in our country. We all know that the number of medical students going into primary care has plummeted over the last generation. We all know that community health centers, which have bipartisan support as one of the best tools we have for improving the health of the country, critically depend on family physicians.
UNC's Dr. Evan Ashkin, a key developer of the program and the site's residency program director, offered additional insight.
Well, for years we've been collaborating with Piedmont Health Services, trying to figure out how to expand services to provide access to underserved populations in our area. Happily, there's been increasing interest among medical students to work with underserved patients, and actually interest in working with Latino patients, which is a real need in North Carolina since we haven't had a lot of providers with this skill set.
UNC residents selected for the track are being immersed in full-scope training geared towards rural underserved communities. Residency Director Dr. Christy Page shared what they're learning.
Residents who are doing the track are learning more about team-based care, they're learning more about how to contain the cost of care, and they're learning more about how to be responsible and make good decisions with their clinical reasoning skills with limited resources. And they're learning how to develop really important relationships to improve the health of their community. So we are so excited.
For NC Health Tracks, I'm Peter Graber.